I'm going to start. Okay. Now you can start, sir.
Okay, thank you, Dheeraj.
Welcome, sir.
Good evening, everyone, and Jai Bhim to all. Welcome to this series of talks that we have arranged for all of you, which is the post MBBS career guidance. And at the outset, we should thank Nalanda Academy, who is giving its platform to us to have this interaction. Of course, Anup Kumarji today is not available because he is busy in another class. So we would just go ahead with his due consent and permission. And I think before we venture into the topics per se, we have a few initial introduction that we need to talk about. And the first one is that how this idea cropped up and how did we think about doing these sessions. So in our medical fraternity, we come across so many of our colleagues who have been kind of wanting to have such guidance sessions, starting very well from the MBBS entrance exams, which we call as the NEET undergraduate exam, extending up to the NEET postgraduate exams, wherein the students want to know about how to prepare and the various options which are available at the level of choosing colleges for undergraduate, as well as choosing the careers and colleges or the post graduation courses through the NEET PG exam or through the INI-CET exam. We would also like to extend our sessions to guidance about choosing the super specialty programs, and we are still in the preparation for it. So meanwhile, we have just started this series of talks about post MBBS career guidance, including post graduation and other higher studies after graduation, that is after doing MBBS, either in the form of MD, MS in India or courses which are available abroad. And we are happy to announce that this is the second of its session that we are organizing here on the Nalanda platform regarding career guidance after MBBS for post graduations, either in India or abroad. So a few months back, we could organize the first session. It was very well received by our colleagues. And here we are with the second session. And today we have two eminent speakers, two dedicated people. I welcome both of them, Dr. Ateet Fulmali, who is doing his MS in general surgery at the Department of General Surgery at AIMS Nagpur, as well as Dr. Sheetal Meshram, who is a MD there from US, and she is a practicing hospitalist there in Colorado, in the United States of America. And both of them have put in a lot of hard work to make you people have the feel of both of the sessions and the talks. I welcome both of them. Then why did we choose the Nalanda platform? The reason being very simple. We know that the mantra of Nalanda is democratizing education, and probably this is where we find our roots. And we sort of begin by acknowledging our role models, which to my mind, starting from Samrat, starting from Tathagat Gautam Buddha to Samrat Ashoka, and then Jyotiba Phule and Chhatrapati Shahuji Maharaj, and Savitribai Phule and Baba Saheb Ambedkar, who have always pressed that education is the key to uh, all the doors in this society. And of course, cultivation of the mind should be the ultimate aim of our existence. In that light, we have been guiding in various platforms to our graduates, postgraduates, and super specialty aspirants. And therefore, we landed up into these series of sessions and talks. So we have been thinking about organizing these sessions in various streams, as I told you, not only for the NEET undergraduate, also for NEET post-graduation, INI, CET, and doing post-graduations either in the US or in the UK or in Australia, Canada, or in the Gulf. We also have requested a few speakers who would be taking sessions on careers in research, uh, some few people in doing DNBs, either on the post-graduation level or super specialty, as well as for the combined defense services, armed forces, and also the administrative services for which we are eligible after doing any kind of graduation. With this, I bring you to today's session, wherein Dr. Ateet Fulmali is going to tell us about his experiences, his journey, his road of how he traveled through being a undergraduate from a reputed institute to landing up into another reputed institute to do his post-graduation. And this would be a general perspective, but we see here that he's a surgeon, so he would also give us insight into his thoughts and feelings about how he has traveled this road. And I hope all of you would be benefiting out of it. Welcome all. And I would request Dr. Ateet Fulmali to take over and share his screen to begin his presentation. Welcome, Dr. Ateet. Over to you.
Thank you, sir. I'm audible.
Yes, Dr. Ateet,
Okay.
please go ahead.
Thank you, sir. Good evening, everyone. I'm Dr. Ateet Fulmali. I'm a junior resident at Department of General Surgery, AIIMS Nagpur. And today's topic of discussion is post-MBBS career guidance. Now, before this, I'm greatly thankful to Digital Nalanda for giving me this platform to do this, and also to Dr. Pankaj Vaidya sir, who has been my mentor throughout my preparation phase, as well as he was a mentor in MBBS in preparation phase, as well as he helped me decide a branch and how to go further about it. I'm very thankful to them. So this is the second session of this series, and we had the previous session wherein we had Dr. Ashwini, who talked about her experiences in preparing for preparation. So during that phase, in that session, she explained much about how a PG aspirant like goes. That is the experience. That is the experience which is seen in 70% of the people. Most of the people have the same experience. So after discussing much with my seniors and batchmates, we came to a conclusion that when does the PG preparation starts? Actually, it doesn't start post MBBS. Most of us doesn't realize this, but it starts usually from the first year of MBBS. Now, usually when a fresh MBBS student joins, in his first year, he has cleared one of the most difficult exams in India, and he has landed up in MBBS in a government college or private for that matter. And he's on the seventh cloud that I've cleared the exam and I have not doctored. But in that case, 6 months have gone, so much of the things he misses out. But the preparation starts already in that phase. So and the concepts, building the concepts are very important, sir. Be it in any field, the concepts are very important because you see the different subjects, the different things are interlinked with each other, and that can be sorted out only with the concepts. If you have good concepts, so most probably you can interlink good things and you can come to a very informed decision. So for first year, half the year is already gone. So for the rest of the half the year, if anybody is seeing or anybody who has good juniors or siblings, they can tell them to utilize the resources as much as they can, because once the year is gone, the resources doesn't remain available for the rest of the session. So we have the dissection hall, the physiology lab, as well as the parking lab. We need to utilize them properly and clear the concepts, because once they are gone, they're not with us. Well, because if you have the concepts properly, you can go ahead with proper information, with the proper knowledge. And that's why the first year is very important, because many times some questions in the physics exams are asked, which are based on your first year. And then we go for the second year. Now, the second year, as we all know, the third sem, which is the honeymoon period of MBBS. It is the most relaxing period. You can study easily, and also the most relaxing period in MBBS. And also it's the most interesting period also, because the thing is, 4 new subjects are there, of which patho, which I personally like. Patho, you learn the core concept of diseases. Then there is the microbiology. There is the pharma, wherein you study about drugs, and also the forensic medicine. So in these subjects, if you have the core concept of the diseases, if you know the normal, if you know the physiology, you know the pathology. So for that, you need to, again, I'll emphasize on concepts very much in this session. So if you have a proper grasp of the physio and anat, you can easily go on to patho. The patho, studied patho will be very easy. And if you have studied patho very easily, the application of pharma becomes much easier. The same happens with micro too. If you have a good grasp on micro, the pharma, the antimicrobial drugs, you can apply it very easily. And also documentation in our field is very important, be it in preparation phase or be it in real world. So the second year of MBBS is very important from the future point of view, as well as from the preparation point of view. And so what people can do in second year is, if they can afford, they can join coaching classes, or they can also study it on their own. That's their personal choice. But as we go into third year, during this third sem, which is the most relaxing period, we can learn to read slides. We need to revise the histodiagrams. We need to go again back to the first year, clear our concepts if they're not clear. We need to learn the slides properly. We need to know how to read the slides, because most of the times what happens in our exams is we just go through the slides to know their numbers, or we just see how it looks, and then we tell that this is the slide. But that is pretty wrong, I think. If you know the slides, if you know the proper concepts, if you know how we came to the conclusion that this is the slide of this thing, so that becomes pretty easier. And also we need to know the cellular pathology of diseases, because if you know the diseases from the basic, you know how they will manifest clinically. And also the same happens with infections also. If you know the micro, if you are good with micro and if you are good with patho, the pharma becomes much easier. So the second year also, if you correlate with this first year and second year, it's very important. And also in this second year only, at least in our college, we had clinical postings initiated. So although most of us miss the clinical postings during this phase, but we should go. We should at least try to present a couple of cases in at least second year, so that we know what are we going to face in the final year, and also how it's going to be, how the clinical practice is going to be, and also the second year honeymoon periods. Now the third year, now we come to the third year. We are done with second year. We know our first year. We know our second year. Ideally, now the third year is where the fun begins. We come to the clinical subjects. We have
Dr. Ateet, we can't hear you. Dr. Ateet, can you please check with your settings?
Ateet sir left.
Okay, we will request him to join again.
Yes, he joined. He joined.
Yes, welcome back, Dr. Ateet. You just unmute yourself and again
Am I visible
share
now?
your screen. Yeah, just share your screen again.
So, just a second.
Yeah. Yes, your screen
So,
is
sorry
visible.
about the connection.
Yeah, please go ahead.
Now the third year. We're in third year. Also, during this phase, we were going through the ENT, ophthalma, and PSL. So now we have this cleared. So now we are just looking after the cases, and with the basics we can correlate things, and we can easily get the management. Now this is the time. This is a very good time. You know, the sixth time is basically more free than the third sem. So in the sixth time, you can utilize this time. Once this time is gone, it's never gonna come back. So now you can utilize this time. You can utilize this time to revise the first 2 year subjects if you are not pretty sure about them, and you need to go ahead with the third year too. Now this is the time when people ideally join coaching classes, or if they don't join, they at least start reading good books. Now Ashwini in the previous session told about books. She also did put emphasis on the first state for USMLE, which is actually a very good book which most of the people use. So this is the time either you start with the coaching ideally, or you utilize good books to just start your preparation. And then again in third year too, you also have final year coaching, so you can again present some cases. You can know how to take history. You can see how the examination works, and you also have examinations from the third year subjects too. Now the thing about PSM is that you need to mug up. But if your institute has good rural side, because PSM is basically learning about population. Now, if an ophthalmologist doesn't get eye cases to see, so there is no use of studying ophthalm, or an ENT surgeon not getting ENT cases. The same applies for the PSM too. If the PSM doesn't have population, it is basically preventive medicine. So if you don't have population, so PSM becomes quite tough to read. So if your college has that, which actually our college had, if your college have rural postings during PSM, wherein they give as a topic during each posting, so that would be much great. And PSM is studying PSM is much better. Now we come to the finals. Now this is the most fascinating part of MBBS, because all the things that you've read, all the things that you've dreamt of, all the branches you see which are working outside clinically. Now this is the place, this is the year where you study all these things. You have all the medicine, pediatrics, surgery, OBGYN, and also you have the short subsection and the final MBBS like anesthesia, psychiatry, ortho, radio, and derma. Now this is the major chunk of final MBBS. Now by this time, if you are an ideal student, and have you studied with your core concepts? So you ideally must have revised your first year thrice, your second year twice, and your third year once. And if you had attended clinical postings, so you must have given a superficial reading of all your final subjects. So it all just sounds unbelievable, surreal, but people do those who get ranks in 1 to 100, maybe 500, 1,000 also. I've seen interviews where people have started preparation from a very long back, starting from second year, some started from first year, who had the proper guidance. So ideally, you should do this. Most of us don't, because we don't have proper guidance. But now with so many platforms, we have all the guidance. So most of the people should do this in MBBS only, because that would save a lot of time after MBBS. Now, if you haven't done anything, now if people have just enjoyed the MBBS life, they're just passing and they're just chilling and moving on, and they'll say that I'll do it after MBBS, after internship I start, because most of the people do the same thing. So, but still we have some time left. If you want to save some time, start reading. Start reading good books. Clear your concepts. Clear the basics from first year, because final year is the time wherein you will require all the knowledge that you have gained in your MBBS from anything. All the knowledge that you have gained, this is going to be utilized in your final year. Now, ideally, people join, most of the people are, these years, 60% people population join coaching classes in third year only. But if you haven't, you can still go for a coaching class if you want. Now, it can be either offline or online. Now, if it is offline, there are some coaching classes which give offline coaching, so you can follow their schedule. And their schedule is not according to according to the university exam preparation. Their schedule is according to go in the direction of that only in the preparation. And if it is online, so you can make your own schedule. You can know the topics. You can talk to your batchmates or seniors or juniors, and you can do it according to your style. But during in all these things, concepts are very important. From first year to final year, if you have good grasp of concepts, you will proceed very nicely. Now, all you need to do during this time is just read and read and read and just read. Because final year, it's vast, it's tiring, and you need to be very good with the concepts. By the time the final year university comes, you must have read a lot. But in the end, it doesn't matter how much you have read. If your concepts are clear, you can pass the storm. Just that's it. And the storm is not the university exam, because anyway, ultimately everybody is going to pass the exam and everyone is going to become a doctor. The storm is the storm is the NEET PG exam or INA set, for that matter, whatever you prefer. Now, with all the concepts we have learned during our MBBS, now this is a type of question which you are going to face in the exam room. Used to ask was 31 weeks, 30 weeks pregnant. Now the doctor questions the husband about the timings of contraction, which is says to be about around 3 minutes. The patient is admitted and gives birth to a healthy baby boy who weighs 400 grams. The lady is told about the exclusive breastfeeding and vaccination, which is compliant with, and all the medical directions which she follows. But 5 years later, she again comes to pediatrician with the same child who complains of pain in the left ear, which turns out to be infection. So for that, he gives him the antibiotic and tells him to stay away from swimming water for till he's older, and the infection subsides. But in reality, the child is actually you, and you grow up interested in biology and tech MBBS ultimately. And during your internship postings, you come across a coal miner who was brought in an unconscious state to the emergency room after a blast in a mine. And after the blast, his carboxyhemoglobin level got raised, and he was diagnosed with carbon monoxide poisoning. So the question is, carbon monoxide poisoning is a known inhibitor of ETC. So which complex of ETC is inhibited by carbon monoxide? So the questions they are asked in these exams is not the one-liner. They will give you a whole history. They will ask. They'll put any random stuffs. They'll put anything, and then they'll ask questions. But the thing is, this is just a meme. But the thing is, the question is really interconnected to everything. If you have your patho, if you have your micro, if you have your OBGY medicine, concepts are clear, you can easily answer the question. Now, this is the type of question which you are going to face. Now, till MBBS, we are done. We have read, we have not read, it doesn't matter. Now, the time comes. Now, the time comes when we have to go, when we have to do the PG preparation. If the first attempt was not clear, Ashwini told it very deeply about everything. That is the experience of everyone, including me. I didn't get good ranks in the first attempt. I was giving exams. Now, but during the test, the only thing is that you need proper guidance. You need to know what to study, how to study, and which things are to be given importance against what. So now, a French philosopher very nicely said that the eyes only see what the mind is prepared to comprehend. If you have seen something, if you have read something, you know what to answer, when to answer, and what type of question can that be. Now, during the PG preparation phase, the major part, the most important part of the preparation is a grant test. If you don't give grant tests, there is no point in preparing. There is no point in investing so much of time, because grant tests will only tell you give you the insight about how your preparation is going and what you need to know and what you need to study more. Now, if you have done nothing up till now, nothing. So all you can do is start with the basics. Like Ashwini said, you're going to have to start from the scratch. Read all the subjects once. Now get to know the chunk of the syllabus. If you, it will take around 3 months, 3.5 months, or 4 months at max. If you have joined online coaching class, and if it is offline, they'll follow their own. And if it is offline, so they'll follow their own coaching classes. they follow their own schedule. Now you just have to go through all the subjects once. You need to get to know the chunk of the syllabus, how the subject is, how much questions are asked from the syllabus, how much do you need to put focus on which topic. Now and accordingly, you are at home or you might be working, you might be working somewhere. So you just need to schedule your day according to the type, according to the need of the subject. Like if you are weak in some topics in ophthalmology, so you can get done with that topic. Or if you are very good in HNF and ANAT, so you don't need to put much focus on that. You just need to put focus more on the topics which you are weak at. Now the thing is, there are 4 types of known. So there are known knowns, known unknowns, unknown knowns, and unknown knowns. So now we know the known knowns, which means the things which are aware and we can easily recall. The known unknowns are the things which we are aware, but we don't understand. It's like, say, for example, we know a plus b whole square is a square plus 12 plus b square, but we don't know how the formula is derived. That means we need to go back to the concept. How was it derived? We know the answer, we don't know the concept. The simple thing is we need to go back, we need to read, we need to know how it happened. Because the question they're going to ask is not based on what is the answer. The question they're going to ask is, they're going to test your knowledge basically. How can you come to conclusion? How can you come to diagnosis? And then how can you proceed according to that? Sometimes they might tell you the history and ask you the diagnosis, and they won't tell you the diagnosis. And then they'll say that choose the option wherein they'll ask about your investigations. So you need to know your concepts pretty well. So if the known knowns are good, the known unknowns you need to focus more upon. 60% of the question shall be from the known knowns only. Now we are again reading. We have done a first reading. We need to proceed again. During this time, when we are reading, we don't need to get done with everything and give grand tests. As legends say in the PG preparation, these coaching classes, you need to start giving grand tests from yesterday. Like when you have started, before you start, you should give grand tests. You should continuously be going on giving grand tests because they'll tell you, they'll give you an insight on what you're doing, on how you're going. You just need to experiment with them. Like in some grand tests, you can go aggressive. In some grand tests, you can go defensive. In some grand tests, you can mark everything and just see how it goes. You need to know which subjects are short, which you're short on. Now, while doing grand tests, you just need to know that you don't need to focus on how many negatives you've got or how many corrects you've got. You just need to review the subjects, the topics. Now, initially, when you're just preparing, you're not even done with one single reading. You need to give grand tests and just see the topics which you have read, are they wrong? Which means the unknown knowns. You need to clear your concepts. The right ones I know you're good at, so you don't need to do them. But the wrong ones, you need to focus more upon them. You need to review the grand tests in a very systematic way, in a very efficient way, so that your time is also not wasted and it should be fruitful actually. And then comes the importance of short subjects, which Ashwini clearly, very well told last time, that you don't need to put your whole day in studying a short subject. Now, she added differently. I'll say that while giving grand tests, there are questions from short subjects, 1 or 2 questions from the subject age. So you don't need to spend a whole day, obviously. But all you can do is just go through the GTs or your custom the topics which are being asked repeatedly. Not you can seriously just by you say just I'll read, I won't use duties, and I just go to the exam and I can do excellent. Yeah, there are some people like that, but very few do like that. They're super talented. Most of us need to practice a lot. So just practice MCQs as much as you can. Now we finished our first reading, and our score is still not up to the mark. So what to do? Now this is the time when reality hits. We have studied everything. We did everything. Like Ashwini said, after the first attempt, she did everything. She was perfect with everything. Her scores very good, but still in the final exam, the reality hit. That happened. The same happened with me. I did everything, but still my rank was not that good. So why that happened? That was just that's it. People were more efficient. People put more time. People were very good with things. So this is the time when you need to look into yourself and see what you're doing, how you're spending your time. All you need to do is again give GTs, more GTs till you don't get your desired score. You can also go for subject-wise tests. You can also go for your custom models. Custom models are very important during the initial phase of preparation. During your mid and starting phase, you need to get more GPs and SWDs. SWDs will tell you which are the major chunks which can be asked. GTs will tell you in general everything. So according to me, I didn't give much GT. I didn't give much subject-wise tests. So my focus was GTs only. You have to give more GTs. You have to be proper relate things. And if you after your first reading, then you're in a second reading and you're giving GTs, know what topics you're strong at and what topics you're weak at. So you phase you need to have, there are 90 subjects, but you need to have a 20th book wherein you say that all your volatile topics, all your tables, all your values, all your investigation of choices, all the diagrams that should be in that book. That is a very important book, which is very important during the last year. Also, you need to practice a lot and a lot of MCQs. By the end of your second reading, and when you are nearing the exams, you should be at least doing 200 MCQs a day, at least 200, because you are done with the topic. You know these things, but you need to revise it again and again and again and again till your exams, because it's human mind. It's not perfect. We forget things. So you just need to go ahead. You just need to practice as much MCQs as you can. Now, this is our the last phase done. This is just during a couple of days before the exams. You have 19 subjects, a huge exam with 2 lakh 50,000 participants. The seats being only 20,000. So obviously it's not impossible, but it's difficult to get into that seats. You have to get the seat. You have to get into PG program because you have invested your year. You literally have given everything to that. You have been doing that. So you don't need to do the whole 19 subjects again and just feel frustrated and I'm not able to do that. All you need to do is utilize the 20th book in the last year. Everything you have written in that, just read only the values, the tables, the flowcharts, the diagrams, everything that you have read, that you have covered in your 20th book, that should be it. And that should be very efficient. And also, you need to emphasize more on the previous year papers because INSET has a trend of following same topics. Of course, as 60% of the topics will be repeated, 40% of the topics will be new. But if you have good concepts, good grasp on your concepts, you can certainly go ahead very well. But NEET doesn't have that much repeats, but INSET has. So you just need to follow the previous years too. Ashwin said that in the last video too, and you should be thorough with your previous year concepts. You need to know because you never know which question which topic will repeat when. And again, many people say that in exams you should be more defensive, but that's not the case. You should be more aggressive in the exams because once you're even if you get something wrong, you'll have 3 more plus points if you get it right. You just try to be aggressive, and this can be decided when you are giving your GPs. You have to give more GPs. You have to be aggressive. You can go average. You just need to know, and that's it. If you want to ask anything, you can follow this. Over to you, sir.
Sorry, I think there is some issue with Dr. Ateet's internet connection. He's going to get back to us. We are just requesting him to join again.
Hello, Ateet sir. There is a question in the chat box. Which are the best MCQ books for preparation of PG entrance?
Hey, hold on, hold on.
Okay,
We are not yet for the question sessions. He has not
okay,
completed.
okay.
I would take up the questions. Please, you keep yourself muted. If we need your help, we will let you know. Dr. Ateet, are you in the meeting again? Yes, now he has joined back. Yes, Dr. Ateet, we can see you. Request you to unmute yourself and again share your screen.
Yes, sir.
Yes, Dr. Ateet, you are audible. Please go ahead, but your screen is still not visible. Can you please share your screen?
Yes, sir. I can see. Okay.
Yes, now we can see your screen. You can put it on the full PowerPoint mode and then you can go ahead, please. Please continue.
From where did it stop? Okay, sir.
Yes, please go ahead. We can see. Yes, your slides are also moving. Please go ahead.
I was, sir, I was done with the presentation. Anyway.
So your presentation is complete, Dr. Ateet?
Yes, sir.
Okay, that's a good thing. Thank you so much. I think everyone would agree that this was a crash course that Dr. Ateet has given us in a brief talk of say 20-25 minutes, and we are thankful to him. With that, we will start the question answer session for this particular talk, which Dr. Ateet took for all of us. So, Ateet, if you can see the questions in the chat box. So there is a question from the YouTube chat box. Which are the best MCQ books for preparation of PG entrance? Can you please take up that question?
Yes, sir. Sir,
Yeah, please go ahead.
yes, sir. Actually, there is no such thing as which is the best book for practicing MCQs as such. There are many reputed authors, like for medicine, you have Deepak Marwa; for surgery, you have Pritesh Singh. Then there are books of various authors now who gives good books with good question answer. You cannot say as such that there is a good book. For medicine, you can use Deepak Marwa; for surgery, Pritesh Singh; for ortho, ophthalm, and ENT, you can use the Tripolo book. For PSM, you have UX's book. Uh, there is no such book as such. You can say it is good. All books are good. I personally hadn't used books. I was just into few banks online tutorials because they give you wide choices. Like you can use custom modules. Then there are tags. You can customize your model actually.
Thank
So
you.
I personally prefer the
Yeah.
online platform.
Yeah. Thank you, Dr. Ateet, for answering that query. And I think Dr. Rajay had asked that question. So just for my perspective, so these books keep on changing. But for that current period, current time, which are the best which can be followed, such that you are able to revise everything in time before the exam, making a good schedule. Because revision is directly proportional to your success. So what happens is you should be able to revise. So such a book you should choose by with which you are able to revise maximum number of times. And if you would like to know the latest one, you should be in touch with your immediate seniors who are going on with this preparation to answer your particular question. And in fact, if you want to talk to Dr. Ateet or to me, you can anytime call us. Our phone numbers are available in the chat. Dr. Ateet is a junior resident at the Department of General Surgery at AIIMS Nagpur. And I am Dr. Pankaj Vaidya. I am a professor of pediatrics at PGI Chandigarh. So with that, Ateet, we will go to the next question. So here, Dr. Pratik is asking us when you show best degree holder doctors like these, we juniors get more motivated. So that's a good thing. Pratik, thanks for the compliment. And probably this question is actually, this is not a question, it's an comment, and we appreciate Dr. Pratik's comment, because that is the whole purpose of starting this series of talks. And we would in fact request all of you to propagate that we at the Nalanda platform are taking such sessions, and more and more of our undergraduates and postgraduates should join this session to benefit maximum from these. So all of the speakers are very esteemed in their field, and we have brought these pearls together to kind of tie them into one rope so that they can help you with your preparation. And of course, we expect that very soon when you become so-called seniors and successful in the medical career, you should take up the role of mentors. And this is how we are intending to build this chain of people who are connected. And that is how we are planning to inculcate the feeling of fraternity amongst our people, as always talked about by Baba Sahib. And of course, there are many more, Dr. Pratik, for you to just to tell you that there are many more who are very high degree holders, and I'm very confident that most of you, all of you, would be very high degree holders very soon. So you should look towards the brighter side, and my all best wishes are with you. The entire Nalanda team and our medical fraternity wishes you luck. So Atit, there is one more question for you, if you can please take up, by Dr. Vishal. He says, how to do integrated reading of medicine plus pharma plus path plus PSM. Can you please take up this question, Dr. Atit?
Yes, sir. Yeah, medicine pathology and pharmacology all are interconnected. I don't think there is any connection with PSM, that's it. But because PSM being a totally different subject, but there are some schemes in government which can be applied to some topics in medicine, but not that much. So PSM as such, you'll have to revise whole in the notes which you make. And regarding medicine, pharma and paths, you can go either system wise like CVS, GNS, RS, and GIT. You can go system wise. Like I said during my slide show, that you first need to know your first year, then second year, and then final year. If you know your normal things, if you know the normal things well, the anat physio, biochem, you can certainly progress to the abnormal things, the patho. And once you know the pathology of the disease at cellular level, it's very easy for you how it. So for this preparation phase, you have to do integrated reading. You should go system wise. Like if you're reading CV, so just start with physio. It's very easy. It will take around 2 hours to get done with the notes. Then go with patho. Again, read. Pharma, you have to read, and then just solve MCQs of these three subjects: physio, patho, and pharma. For CVS only in custom models in online question banks. And if you have done the MCQs of this, now go to read medicine. You can connect the dots. If you connect the dots, if you are able to properly connect the dots, you can certainly move ahead, and of course it becomes easier. So whenever you want to go to final year, just go to your first year, then second year, and then switch to final. It becomes much easier.
Yeah, thank you, Dr. Atit, for answering that query for all of us. And there is another question wherein Dr. Prasenajit says,
Hopefully.
PG preparation days, PG preparation days is very stressful. How to tackle this? Okay, I think Atit, if you can put up your thoughts, then I would like to add mine.
To tackle the PG preparation for stress, you need to have good mentors. I usually used to call you and Nikhil sir for the same. It's actually a very lonely phase. You are trapped in your room. You are just sitting the whole day, and you need to have good seniors. You need to have support of your family properly. Everyone has support of their family, but still they feel very lonely. So they just need to be with good seniors, with good friends. They need to be actually very social. This is the phase of life where you are mostly trapped in your room. You don't need to do that. You need to go out into hang out with people. People say that during preparation phase this is only study. That's not the case. You should have a social life. If you have good social life, the stress part is just terrible. And if you really want to be stress-free during your preparation phase, just take Pankaj sir's number and just call him very frequently. I'm sure just listening to him, half of the stress is over. He means you're so anxious. I used to remember I was so anxious during all the time, and I used to call him and his soothful voice, Ateet, bol. And I cannot mimic his voice, but his soothful voice was so pleasant for me. So you can just contact any of your seniors whom you have trust.
Thank you, Dr. Atit, for answering that query and your kind, generous words. My take on this would be that, of course, anything which is going to yield you something which is very high profile and you something which you aspire for would create some amount of anxiety. But the matter of fact is that this anxiety has to be optimal. It should not develop into a stress. So this optimal kind of one can say attention to the due attention which is required by this whatever preparation you are doing is mandatory. So it should not get converted into a stress. It all depends on your mind, how you perceive about what you are doing. So everything is possible if you do it in an organized way. And my suggestion would be to make a good timetable and try your best to stick to it. And if you plan your work well, then they would definitely work. These plans would work well. So with that, Dr. Atit, there is one more question which says Dr. Raja says watching videos of prep ladder and marrow is sufficient. Is it sufficient? Watching videos of prep ladder and marrow, is it sufficient?
Now watching videos of Marvel and Kepler. Actually, I didn't do the online question classes. I was just using the question bank and the test series. But I guess they have enough of the materials. They have more than enough. They have 200% of the stuff. They have put all the Harrisons and William Love and that ideas. So I think that is more than enough. If you do it religiously, if they follow religiously, that would become a very good brand.
Okay, thank you, Dr. Atit. And there is another from Dr. Samantha. He says, Sir, kindly enlighten us on family medicine pros and cons and scope. Dr. Samantha, we will be taking such sessions separately, and in fact, we have a option wherein you can get connected with the mentors 101, and you just have to be part of the Nalanda Academy, and we would ourselves get in touch with you with whatever specific such general queries if you have. Now that you have asked that question here, we are running
So I
short
think
of
this
time, but
question is for you.
Yeah, but for brief, we would like to tell that uh, that no branch is inferior. So if you like a branch, just go for it. And before entering into a tunnel, like we first uh, make up our mind what would be the end result when you exit from the other end of the tunnel. What is that you are going to see? So that should be the state of mind. And these days, now that internet is very easily accessible, and you can google down to all those things, the information which you want, where all these courses are available, how good or bad these are. And of course, like through Nalanda Academy platform, we are trying to connect 101 the mentees and the mentors, so you can ask these specific queries to us, and our numbers would be available on the chat box. Again, Raja says thank you very much. Dr. Vishal says also do a live on scope of paraclinical and non-clinical subjects, while clinical departments are glorified and the paraclinical don't get much respect. So Dr. Vishal, that's a misconception. And there are paraclinical subjects, in fact non-clinical subjects, which actually you would find are gaining much importance and are quite sought after these days. And please take out of your mind that non-clinical and paraclinical subjects are not good. And during your MBBS days, depending on which medical college or institution you are doing your MBBS from, and the kind of exposure in these particular departments you have got, there would be a bias in judging whether the non-clinical and paraclinical departments, how good are they in comparison to the clinical departments. So for example, radiology, a subject being which is so much related to it is said that it is clinical, but you would find that in fact the radiologists don't have much exposure to the patient, yet the branch is a top branch. And in the INI-CET, the top 5 people would prefer taking radiology in the best centers of the country. So my point is, it doesn't depend on whether it is clinical, paraclinical. Science and medicine have gone far ahead, leaps and bounds. So you should go ahead with whatever you like best, and whatever your aptitude says that you would be able to do good. And our purpose of doing these sessions is that we can inform you people, so that it should be an informed choice and an informed guidance. And so matters like these we may discuss 101, and you can call any one of us, and we would make our numbers available in the chat box. Dr. Ateet, I would request to put in your number and the timings when you would be available, the days in the chat box, so that anybody who has any specific queries can get in touch with you. I think we still have a few minutes left. Any one of you has any specific queries in the Zoom meeting? If anybody has queries, they can just unmute and speak up, because there are no questions in the chat box in the Zoom meeting. And YouTube, Dr. Maligi Kumar says, I have one doubt. Dr. Maligi, can you post your question here? If there are no more questions, then we would move ahead to the second session, because for that we have a very eminent speaker, and she is actually participating for all of us from the United States of America, from Colorado. I welcome Dr. Sheetal Meshram, and we are proud to say that Dr. Sheetal is one of our colleagues who actually did her MBBS here from Government Medical College, Nagpur. But after that, she moved on to the United States of America, and she did her MD in internal medicine from the USA. and she has been practicing as a hospitalist since the last 10 years at Colorado in the United States of America. Dr. Ateet, I would request that if you can stop sharing your screen so that we can move ahead and request, welcome Dr. Sheetal. We will request Dr. Sheetal to share her screen, and we are happy. I would especially like to thank Dr. Sheetal to have accepted our request to take a general talk about how to do higher studies in the United States of America, especially after doing your MBBS, that is the undergraduation of a medical field in our country. And she was quite generous enough to accept our request and to take a general talk about how things or what all courses one can go about after doing MBBS. And with this, I hand over to Dr. Sheetal and request her to begin her talk.
Thank you so much. Thank you so much, Dr. Pankaj and Digital Nalanda for inviting me for share my thoughts and my journey in USA. Am I audible, clear, and my slides visible to you all?
Yes, Dr. Sheetal, you are very clear, and the
Okay.
slides are also visible. We can see very well. Please go ahead.
All right, so we're just gonna talk about like what are the options available after your MBBS, after your graduation, back home, like in India or somewhere else, and what are the opportunities available in USA, okay? So let's talk about that. So just briefly about myself, just to know like where I come from, right? So I did my MBBS from Government Medical College, Nagpur. And then after marriage, I moved to USA. So I didn't know that, and there was no plan to move to USA. I didn't even know what exams we have to prepare to get into, what are the career opportunities for me. So when I came here, I started looking like, hey, what is the exams I have to, because I wanted to practice here, right? So I started preparing USMLE, gave my USMLE. I was doing actually my PG in India, so I abandoned that. Started preparing USMLE. I prepared for that. I did my 3 years residency in internal medicine. And then since last 10 years, I'm practicing as a hospitalist. We're going to talk about like what are the opportunities like hospitalist versus just outpatient versus a hybrid model. So those are some of the options, but that's my journey. And let's begin our talk. So we're going to talk about what is the post-graduation path here. So we can do practice as like a physician, right? After obtaining a license, that's called as residency. Then you can do fellowships, right? Even after residency or even without it, we're going to talk about how are the ways to get fellowship. There's an MPH path, Masters in Public Health, MBA. There are some hospital-based MBAs you can venture into, and then PhD programs, right? And some research fellowships. So we're just going to talk briefly about all those. So what is the path, like how we get into residency to become a licensed physician so that we can practice here? So there's some basic difference, right? In India, once we get MBBS, right, you can practice, you can, work, you get a license once you register, right? But not in USA. So every practicing physician here is at least he has or she has an MD degree. So you cannot get a license to practice once you are out of your MBBS, which is called as a medical school here. So every practicing physician has to get through residency and then they obtain license in their respective field, and they can practice. So what is the path? And there's another very striking difference here. So in India, your scores are everything, right? Your entrance, like whatever entrance exams you're going to go through to enter into residency programs, that's everything. Not in US. Okay, so there's a whole packet which is they consider. So of course your USMLEs, which is entrance exam, and there's occupational English test, which is very, very new this year. Then your US experience, like, do you have any hands-on experience? Do you have any exposure to US medical system? Okay, and do you have any recommendation letters, right? The recommendation letters from your professors back home or in US recommending you, like how you are a good fit to that particular specialty. So that's another comes into your packet. About your personal statement, like why you want to choose a particular specialty, like what's the motivation behind it, how you're gonna excel in that particular specialty. And then ECFMG certification, we're going to come to that like in a moment. So that's a whole packet. So it's not just about scores, it's just about your whole packet, and each has their own importance. So let's talk about in details about each of them. Okay. So what is USMLE? So USMLE stands for United States Medical Licensing Exam. So that's kind of, it tells you like, hey, that's the exam you have to go through to get into the residency program, and which will make you a licensed physician to practice here. It's mandatory. So it's not just for international graduates, it's for US graduates as well. The difference is that they take their USMLE during their med school. So while they're doing their med school, they take this USMLE. All right. And we can do that too, like during their MBBS, but there are some, like, that's a timing, right? When you can take which step. So it has 3 exams, which are known as steps. So it's step 1, step 2, CK. CK stands for clinical knowledge, and step 3. So until this COVID hit, the step 2 had 2 parts. So step 2 CK, which is a clinical knowledge, and step 2 CS, clinical skills. So they eliminated, they put on hold on this step 2 CK, step 2 CS during COVID, because that exam has to be conducted only in United States. So they had to put hold during this COVID time. And in 2022, January, they eliminated that step 2 CS altogether. So it's no more considered part of USMLE. Okay. So only has 3 parts: step 1, step 2 CK, and step 3. Okay. So what is USMLE step 1? So it comprises of your first and second MBBS subjects, all anatomy, physiology, biochemistry, pathology, micro, right, forensics. So all the first and second MBBS subjects. So once you completed all this, so you can take your USMLE step 1 or start preparing for even that in your second year, right? But it has that kind of, those subjects. It's a one-day exam, but it's not like your a typical entrance exam back home where you have like 2 or 3 hours to get through, like 3 hours, I believe, right? But it's an 8-hour exam. It's an 8-hour exam divided into 7 1-hour blocks. So each block is 1 hour, then you move to next block, okay? And there's a 45 minutes break time spread in this 8-hour, and there's a 15 minutes tutorial. If you skip tutorial, you can just see that beforehand. There are so many on the website available. So if you just skip that tutorial, you can add in your break time. So it will be total 1-hour break. Okay. So it used to be a scoring exam, but they have changed that too this year. So now it's a pass and fail exam. But on the 3-digit score scale, the passing score is 196. It used to be 194. So they have actually increased that standard 3-digit score now to 196. So you will just get a reporting, hey, you passed the exam or you failed the exam. So that's the USMLE step 1. And what about USMLE step 2? So it's a step 2 CK, right? That's only step 2 right now. So it covers rest of your MBBS subjects, like your third year and your final year subjects, all the clinical, you name it, like medicine, pediatrics, PSM. So all rest of your subjects, okay? It's also your one-day examination. It's a 9-hour though, okay? So there are now 8 blocks. 8 blocks of 1 hour, and and then 1 hour or 45 minutes of break time is spread into this 9-hour. So this is not a pass and fail exam. They report 3-digit score, okay? So that's a passing score here. It's 214. So pretty tough, right, to get into, but that's their the new thing now. Okay, that's a passing score. Let's talk about USMLE step 3. So basically it has the same final MBBS and third MBBS subjects, and but you cannot start just directly to step 3. You have to have passing scores on your step 1 and step 2 CK to appear for step 3. Okay, so and it basically covers the step 2 CK, the same pattern, same material you're gonna revise. So some people they take step 2 CK, and within like a month or even 15 days, people have taken step 3 because it's the pattern and the material and all the things you have to go through for step 2 CK is very similar for step 3. It's a 2-day examination, okay? So on first day, it's a 7-hour day for you, and it's divided into 6 1-hour blocks. So in that first day, they're gonna just ask about the MCQs, the multiple choice questions, okay? And on second day, it gets tougher. It's a 9-hour day. So the first portion is MCQs. So they're going to ask you total 180 MCQs divided into 6 blocks. So 45 minutes each block, and they just divide those 180 MCQs in those 6 blocks. And the second portion of the test is a computer-based simulation. So what they're going to do, they're going to give you cases. It's a computer-based simulation. So they're just going to run a scenario like this, like suppose a 40-year-old female walking into emergency department with this symptoms. So now that case is yours. So so what you're going to do, you're going to ask first for the vitals, right? So, okay, you just have to press the button and then computer will give you all the vitals of that patient. And then what's the next step? You're going to ask about the history, like menstrual history, like a gynecological history, OB history, or surgical history, medical history, right? The past medical history. So you have to press that button and ask to the computer, like, hey, I want to know this, and the computer will give you all that scenario. And then you have to order tests, imaging studies, come to diagnosis, and write all your workup with that patient and treatment plan. So that's kind of a simulation they have to go, and you have to go. And it's 13 cases they give you, and then depending on how quickly you move forward, you have like 10 to 20 minutes for each that case. So minimum passing score on this step 3 is 198. So what next? You have gone through USMLE, you decided you're gonna take this USMLE. So what are the materials you're gonna need. So UWorld, USMLE World, it has like very nice collection of MCQs, which is very, very recommended. When I did my USMLE 13 years back, I was referring to the same UWorld, right? It's very, very nice. What I recommend, don't wait for the last minute until you go through your theory part, and then attempt your MCQs. No, that's not going to be my recommended approach. Start from day one. You can start trying like 10 MCQs, 5 MCQs a day, practice those, because then you will know like, hey, those are kind of questions. What is the pattern, how they are asking questions and what they're asking. Sometimes it's like maybe 10 sentences or 15 sentences in the question, and then they're going to ask you something, out of that. So you have to understand like what is the approach here, what they are asking, what they want to know. So I would recommend to start your MCQs from day one. Read simultaneously the theoretical part. The UWorld gives you explanation of all the questions and the answer. So just reading the answer, you'll know like what is their approach, what they're asking us, and how should you should tackle that particular question. And then simultaneously just increase as you approach to your exam time, just start approaching and getting more and more MCQs. So ultimately, if you're examined within next 5-10 days or a month or so, you should be doing like 50, 100, 200 MCQs in a day. All right, and then you will not read much of that text or explanation. Then you will just go through just the MCQs and get know how much you are scoring on that. The rest of I put in here like boards and beyond and first aid. These are all the other materials. They keep on changing. I did not use much of those back then, but first aid, we used to use that at that time. But these are some of the new materials I found. Embossed library for Step 2 CK. Looks like this podcast is free for students. So just to make a note of this, and I can share my material as well after the talk, and or I can share my number so we can discuss about it in detail. Okay. So as I mentioned, they eliminated that Step 2 CS clinical skill test. So they have introduced this new test, occupational English test. So it's just gonna test the fluency of your English and how proficient you are. And this test is for international students. We got our education in English, so we should not be, it is not that bad for our students to go through this test or Excel. So it doesn't need much preparation, just you have to understand what they're going to ask, what's the pattern and all that. So it basically needs like 4 or 5 days, or maybe I would say maximum week, 1 week of preparation. On this website, you have to register, right? And then there are some free tests available. So you can go through and complete this test. So as I mentioned, in our whole packet, it's not just about scores, right? So you need to have recommendation letters. So what the recommendation letters are? So your professors whom you have worked back home, or once you get in US, and we're going to talk about like how you will get into US, how you're going to obtain experience in US, hands-on, and all that. So you need those letters recommending you about your skills, your hard work, how you are a good fit for a particular residency program. So 3 or 4 recommended, more is better, but 3 or 4. I attached at least, I think, 4 recommendation letters by that at that time. So and preferably, I mean, all my recommendation letters were from US, but because I was here. But if you can manage at least 2 or 3, or at least 2 letters from the US physician and 1 back from your home country, that should be good, but I would recommend, at least couple from US physicians, okay? And these are sent directly to the programs where you're going to apply, okay? So let's talk about what is a US experience, right? So it's not just the experience at your home country matters. Of course, you're going to talk about your experience in your home country, like you did some research, you did your master's there, you obtain your MD, MS degree, whatever, and you can always highlight that and get recommendation letters from that experience. But, if two candidates have exact same, kind of profile of high USMLE scores, but if they don't have US experience in whatever form, right? We're going to talk about that in details, like what the US experience counts. So they're going to prefer a candidate who has some kind of US experience rather than who has no experience, zero exposure to US medical system. So they always prefer a candidate who has been exposed to US medical system and knows how the system works. So how are you going to get into US experience, right? Immediately you will feel like, hey, I'm sitting here in India or wherever. How I'm going to get US experience? How it's possible? So there's this VSLO pathway, Visiting Student Learning Opportunity Pathway, which I did not hear about at the back in my time. So it's a pathway, and it's in collaboration of Association of American Medical Colleges. So what it does, it's kind of a student exchange program, and those students who want to come here to explore US medical system. But your medical college should be already registered with this system already. So I don't know what's the situation in India and how many medical colleges are already enrolled into this program. But what if say in your group there are 10 or 15 students who want to come to US to get US experience? So those 10 or 15 students or whatever amount of students can actually pay fees. So it needs there's some kind of fees they charge you for your medical school to be enrolled in this kind of pathway, right? It's not free. So if your medical college is willing to pay fees for whole students, or for their whole medical college, so rest of the students can get the benefit, well and good. But if your medical college or medical school is not already enrolled and not willing to pay that fees, then 10 or 15 students can pay the fees for the medical school or medical college and get that medical college, your medical college, enrolled into this pathway. So now your students from that medical school can come to US under this program to get some hands-on experience in US, and then you will get recommendation letters. Okay, so you have to go through their website, just type VSLO pathway, AAMC, and then you will get all the details how you can explore this pathway, how your medical college can explore this pathway. It has all the details. We're not going to talk more about on this. You just have to search how you can benefit through this pathway. Then there's this system called FRIDA. Okay. So what this FRIDA does, it just gives you, and once you type, in Google FRIDA, it automatically comes up. It gives you about the residency programs available in United States. So you get a list of all the programs available in United States, where it is located, what state it is, how many residency programs are there, and what kind of residency it's available in their program. So it's a smart way to use the system to find out where's the residency programs available. Some people, if they want to come to any particular state, let's example, in my state, I live in Colorado. So if you search hey, what are the residency programs available in Colorado? So there's many internal residency programs, there's many family residency programs. So what you're going to do you now know where the residency program is. So you can directly, and everything is going to be available once you know, hey, internal medicine residency program in this university in Colorado. You're just going to Google that particular program, or if there's available information there, you can email them. You can search in their website. Like, these are the opportunities available for international graduates or for students as a a US experience. So they can call it sub-internship, they can call it externship, they can call it observership, they can call it anything. Doesn't matter. Okay, you just want US experience. It may be few weeks, it may be 3 or 4 weeks, it may be a month, it may be a 2 month. We don't care. Okay, we just want to land into that kind of opportunity, right? You want experience. So now you have all the database of through this FRIDA system, like, hey, this is a residency program available. You have their website, that program's website, just search it. It takes time, but it's already available. That you just have to put some extra efforts to find out where this experience opportunity available, so I can apply and get into. It's difficult, but it's certainly you can do it. You just have to do your diligent search and apply for those programs. And I myself did some sub-internship, and as I mentioned, it doesn't matter where you get into. I did my sub-internship in oncology, and so it was like four weeks, and I applied to that, and it was like once in a year they open that opportunity for international graduates. I mean, those opportunities are meant for US students, right? But they open up something for international graduates. So that's why I'm asking you to do your diligent search for those, look for those programs. Those open up for international graduates. And even if they don't mention it's for international graduates or not, it doesn't harm you in asking just a simple email, right? To see, hey, when that's going to be available, how long it's going to be. And of course, it's not a paid, and I'm going through all these opportunities, which you don't have to pay. They're not going to pay you, but you don't have to pay. There is some business model going on outside where they charge you very hefty fees and for providing you US experience. I wouldn't recommend that unless you explore all these other avenues which we are talking about right now. Okay, so because that's kind of a business, right? So some guy sitting here in US who has gone through his residency, his or her residency, is in clinic. Most of the time it's in their clinic, right? So outpatient clinic, and for a few weeks or couple weeks or something like that. So this person who is running a business has a tie-up with this guy who is sitting here in US, and then you come and go to their clinic and just observe or do something. I mean, you are not allowed to touch patients unless you have insurance and all that, right? So I personally prefer not to go through those kind of business persons, because why? First of all, I mean, the US professors or the program manager or program director who's going through your whole packet or your letters, right? So they notice, I mean, they do this all every year, right? They screen thousands and thousands of applicants, so they know like this, where this like recommendation letter is coming from, so they understand like what's the business going on outside. But on top of that, as I mentioned, these are all clinic, in outpatient clinic rather than in a hospital. So what I did, like what I personally did, my advantage was because I was already here in US, but I literally went door to door. So I started hospitals near my house, and I just went there. Like, I didn't even know who to ask. I just went there and medical staff office and asked, like, hey, I'm a medical graduate from India, and I want to know how the US system works. So where should I approach? Where should I go? Where can I get that approach? So US American peoples are very, very helpful, very helpful. If you go out of the way, they will find out of the ways, and they will go out of the ways to help you. So that's what it happened. So they connected me, one of the hospitalists in that hospital, in that particular hospital near my house. And they connected me with that hospitalist. And I started observing her, how her day goes, like how she sees patients, admits them, treats them. So I was just was observing her. And I was there for like a month. But she introduced me to a different hospitalist in her group. So I worked with her. I worked with a pharmacist over there. Like, we have a pharmacist here in US, in hospitals, sitting us and helping us, checking all the interactions, checking the doses, making formulations. So it's a different kind of setup. We cannot even think about that in India right now. But anyways, that's not our subject to talk about. But so I work with the other ancillary services as well, how the system works, how the hospital system works. And that's experience, right? You have to put. And when those physicians started, they observed me, they were observing me, and I was observing them as well, right? So they gave me very good recommendation letters. And not only that, so see how the contacts work and how this opportunity, one opportunity, land you into different opportunities. So this hospitalist, which I just met during my observership, right? So she went to a conference, and she mentioned myself, or she mentioned my name to a cardiologist who she didn't even know. She just met in the conference, and she said, "Hey, this is a student, and she's very interested. She wants to, gain US experience. So can you allow her to come to your office and to your hospital?" And he said, "Why not?" And see, I mean, they didn't know each other, but just through their encounter, they introduced me. And I was very fortunate to work with that cardiologist for 5 months. And he was very kind enough. So I got both experience. So in his office, I used to take history and present to him. And then in hospital, we were rounding on all his cardiology patients, and he was even allowing me to see his angiography, his angioplasties, and all that. And that lasted for 5 months. So from nowhere, I landed up into all these opportunities. And simultaneously, I was also going to a family practice physician in his office, right? So within all this 6 or 7 months, I got a mixed bag of experience, from internal medicine to cardiology, in hospital as well as in office. But you have to explore all this opportunity by yourself, right? And these are all free. They didn't pay me. I didn't pay them either, right? So we're going to talk about, like, for those students who are not here in US, how you can grab these kind of opportunities. We're going to talk about that, okay? So as I mentioned, doesn't matter what is the title under. This opportunity, they can title it under sub-internship, externship, observership, doesn't matter. You just have to grab those. Even research electives, right? So in their website, they're going to post about, hey, we have an opening for a research elective for this month. And those who have some background, and even if no background, you can just ask, hey, I am interested in this kind of research elective, right? So you will be here, you are exposed to US system. And as I said, one opportunity leads to another opportunity. Who knows, if you are doing your research elective, you can ask for the professors here, or you're going to look around, you might land up into some other opportunity. So it's all upon you. It's all like how much efforts you are putting to get into those US experience, right? And those who have some kind of a background back home, they can look for even research fellowship, apply for those, As I said, you can Google all the universities, or just type in research fellowship in particular state, or, just put research fellowship available in USA, and then you will get a website where you can look into that opportunities. There's an email available. You can shoot an email, just follow up email, and keep persistent. These are all very busy people. They are practicing physicians. They are doing their research. They are teaching students, and also going through all the candidates interviews, selecting candidates for their next batch of residents, right? So they're doing multitasking. So just don't stop like, hey, I emailed them, but I didn't get an answer. Just wait for 10, 15 days. Shoot a follow-up email. Just keep persistent. And it's going to show up like, hey, they're going to observe like this student is very persistent, very keenly interested in our program. So why not give a chance, right? So things happen here. And living for 17 years in US, I know how system works. So take my word for it. You have to be persistent. You have to look for the opportunity to grab this opportunity, okay? So let's talk about what other steps. As I mentioned, it's not just about your USMLE scores. It's about the whole packet. So the ECFMG certification is part of that. So what is ECFMG? So it's just for foreign graduates, right? So who are trained in foreign country other than US, they have to go through this ECFMG. ECFMG stands for Educational Commission for Foreign Medical Graduates. So what it does, it just verifies that you have passed that your graduation, which is your MBBS, and they're just gonna run all your medical transcript, verify it with your college. They don't verify with you. They're gonna verify with your medical college, right? And I recommend as soon as you decide, like, hey, I want to pursue USMLE, I want to go through this route. Start early because it takes time. You have to register with their website and start uploading all your medical transcript, whatever they ask for. And once they receive all your document, they send all their document to your medical college to verify it. And it takes time, a few months, maybe, more than that. And how, ECFM certification is mandatory, and it's a requirement for all the international graduates to appear for step 3. So if you're not certified, you will not, you cannot attempt you cannot take your step 3. So you have to register, you have to appear for your step 1 and step 2, pass the test, obtain your ECFMG certification, and then appear for your step 3. So one word of caution, or, my experience, how, as I mentioned, this ECFMG, send your documents to your medical school, and then your medical school has to verify that, yes, this particular student has completed all his medical school. And now, we are just verifying all the documents for you. But as you know how our system works in India, right? When ECFMG send your document in India, nobody even bothered to look at, that was my experience. They didn't even open, they didn't even look at my document from ECFMG. So it like past few months, I didn't hear back anything from ECFMG, because you can see the status like, hey, your medical school verified your status and now you're good to go. But so I came to India, I went to my medical school, asked them, and they said, yeah, we got the certificate. No, we don't even care, right? So I said, okay, so what I have to do? So I have to, because I didn't finish whole of my PG program, right, post-graduation program, and came to US, and I have to break that bond, right? So I have to, and they didn't even tell me. I mean, I wasn't like, don't want to, do that, but they didn't communicate it with me, like what the next step. It was just sitting there. My packet was sitting there. So I broke that bond, paid the fees. They were not even wanted to bear the cost of posting that envelope to ECFMG. I mean, that's kind of a negligence or whatever it is, right? I carried that packet to myself to FedEx, Speed Post, and posted that, back in US. And that's how. So word of caution, you have to follow up with your medical school. Maybe things might have changed. I don't know. It's been 17 years. But you have to be careful. This can happen. So you have to just keep check in with your medical school, like what is the status of your certificate and all that. So that's a ECFMG certificate. Okay. So once you ECFMG certified, you can take step 3 and then start applying for your residency program. Before that, there's one more thing in your packet. That's a personal statement. So it's just a narration. It's a statement about yourself, like, hey, why did you choose to be a physician? Why you entered into medical school? What was the motivation behind it? Why you want to land up into residency program, and why this particular specialty, right? Why you're choosing that. And these things are very, very new for us, very, very, very standard for the US students. Every single time, even if they are entering into graduate program, even in some kind of a professional program, whatever program they land up into, the personal statement is very, very standard. Okay. So you have to talk about, and everybody has some kind of, reason to get into, maybe few of them don't, they just want, money, right? But just highlight what was the motivation behind you, just to give some real life experience. So what I what I put into my personal statement was, before joining my PG program in India, I was working as at PHC, primary health center. So those 11 months were, I came across, because I was the only one working there, right? So I got a lot of experience. So I just mentioned like these 3 different patient scenarios, like talking about leprosy, talking about tuberculosis, talking about like a taboo of sexually transmitted disease in India, like how they don't want to open up with a female physician and all that, right? So I just mentioned that. And so my program director, who I interviewed with, he just brought my personal statement and asked about all those questions. So you don't know how your interview gonna land up and what they're gonna ask you. So those were the real life experience you have to put into your personal statement. I wouldn't recommend anybody to copy and paste from internet, right? You can get an idea like how these personal statements are drafted, what you have to put it, but don't put anybody else's, because you are a doctor, you went through your MBBS, you have gone through your internship or whatever experience you have. Just you have to pick those experience and put in a words and put in your personal statement. Okay. So now you're ready with all your USMLE steps, you're ECFMG certified, you have done with your English test, right? You have some US experience or back home experience, you have recommendation letters. Now you're ready to jump in to apply for your residency. Okay. So it's not like straightforward in India, right? Hey, I got my scores, I'm applying, and I got this kind of particular residency. No, it's not that straightforward. It's US, right? So nothing is very straightforward. It's complicated, but everything is computer based, right? So once you're ready with all your packet, you have to apply. And every year, the deadline for application is in September. It changes, the date changes. Back when I applied, it was 1st September. This year, I heard it was 19th September. So it changes, but most of the time, it's in September. So you apply for the programs, right? Then you might apply for 200 programs, right? You apply, and then you start getting responses, right? 99, I would say, you won't hear from them 99% time. So I applied for 200 plus programs. I got 5 interviews. Okay. So that is the ratio. And as I said, it's not about scores, it's about your whole packet. And one more thing, which we didn't discuss before. So they prefer younger graduates. What it means, it's not about your age. It's about young graduates means the date of your MBBS completion. Okay. So most of the program have this criteria 5 or 6 years from their graduation, from your graduation. So if you passed out in, like you have your MBBS completion in 2020, so 2025 or 2026, most of the programs they set up, I mean, they put a cutoff. So, you know, even if you did your post-graduation, even if you did your super specialty, doesn't matter. They count your MBBS completion because they don't recognize your PG programs at all. So even if you did like master super specialty in your home country, they don't recognize, US system doesn't recognize that. So they still count your MBBS completion date is your graduation date. So that's why I recommend our students to start early. Once you decided, hey, I want to pursue this USMLE, so start early because it takes time, right? As you can see, it's a lengthy process. It's a multiple steps you have to go through. And people like in my colleagues, you know, they were preparing for the USMLEs simultaneously during their MBBS. So anybody can do it, right? I didn't know about it. That was not my goal. So I didn't know even about anything about USMLE until I landed up here. But people, you know, students do prepare for the USMLE simultaneously during their MBBS. So you can do it. It's just going to take some extra efforts, but it's doable, okay? So as I said, once you apply, you will get the interviews. You have to go through interviews, you know, you have to go to that particular program where you have got the interview from. You have to interview them. So it's not a one-sided process, right? They are interviewing you like how you are a good fit for their program, but you are also interviewing that program itself. Like, hey, am I gonna stay here for 3 years? You know, is it a good fit for me too? I mean, for international graduates, we don't have that kind of a choice, but you know, those who landed up into 10 or 20 interviews, they can choose, but still, I wouldn't be very picky about it. It doesn't matter where you do your residency. Ultimately, you are free to practice anywhere in the United States, you know, so those 3 years, but, you know, US students does that. So it's just not one-way interview, it's a two-way interview, right? The student is evaluating that program and that program is evaluating that student, okay? So you're done with your interview. Say you have gone through this 5 interviews, and then you are putting like a rank order, like, hey, I like this program like number 1, and this is number 2 and 3 and 4, right? So you just want to put that rank order. Same thing is doing that program. So they're going to interview like 100 or 200 candidates, and among that 100 and 200 candidates, they're going to put their rank order too, like 1, 2, 3, 4, based on how many positions they have. So they're going to rank order that, and then computer makes this match. Okay, it's the matching program. So in March, so you applied for September, or your application in September. You have gone through interviews. Interviews are done by December, January at the max. Some people even gone through interviews in February, but that's rare. But in March, it's called as a match day, where the computer does all this matching based on your rank order list and the program's rank order list, and you get into a program. So if you match, you'll get an email like, hey, you matched to this program, and then there you go. You are ready to rock and roll, right? You are ready to be in your residency. Okay, so that was all about USMLE and how to be a licensed physician, practicing physician in United States. Okay, what about other options? What if somebody don't want to be a practicing physician, don't want to get licensed, or he said, hey, that sounds very, very lengthy process, right? Multiple steps, you have to have US experience. What about other options? Okay. So these are other options. So MPH is a master's in public health, right? It's any MBBS graduates or any medical field graduates can come and do. Even the dentist, if they want to come to master's in public health, they can come for it. They can do it. You have to go through GRE. which is other exam. It stands for Graduate Record Examination, and it's common for all the fields, right? So if you're from medical background, science background, arts background, commerce, engineering, so the GRE is same for everyone. So it's kind of a multiple choice year-round exam, right? Some people, even if you go tomorrow and take the exam, you're gonna get some scores, right? So it's that kind of exam. But our goal is to get into good score in GRE, so that you land up into good program, get a good funding. You can apply for scholarship from your country, from your state, right? So that's kind of a GRE. It requires like few months, like couple months preparation. Some people take 6 months, some even take year, but it's not that tough, right? It's compared to USMLE, it's nothing, I would say, because it's a 10th based question answers, in that. So it's not that tough. But of course, you need some preparation for that to get to know like how this GRE work. Of course, you have to go through TOEFL or IELTS, which is a test of English language. Either one of TOEFL or IELTS you can do. So GRE or TOEFL, GRE or IELTS. So that's a combination you can do. It's a like 1.5 year or 2 or 3 semester course, MPH, right? And other options like MBA, yes, you can come for MBA. You can give GRE or GMAT, either one of them. Of course, TOEFL or IELTS, that combination will land up into MBA. So people have come for MBA for hospital administration or something like that, okay? And you can come for PhD. So generally, you're not going to get direct PhD. So say there are some masters, or if you have a background for masters, you already did your masters in India, and you can apply for PhD. It's still tough. They make you to go through some master's credits, and then, or some programs are combined masters and PhD. So, I do know some students who have gone through some kind of certification courses in European countries, and based on that experience, they just started emailing US physicians based on their experience back home or wherever they did. And those students got into PhD program. That's pretty impressive, right? So without even going through GRE or GMAT or TOEFL, of course, I think you have to give the TOEFL or IELTS just for, for the sake of it, right? Just to fulfill the requirement. But as I said, you can start emailing the program directors or the research or whoever is was the head of that PhD program. You can start emailing them and share experience, like how you have experience in your home country or wherever, and land into PhD program. Pretty impressive, right? And same goes with fellowships. So fellowships, typically you go through your USMLE, you complete your residency program, you get ACFMG certified, right, beforehand, and go through your residency program, and then get a fellowship. But some fellowships are like that for a few months, where you just come here to get some, experience how in US system in that particular specialty. It's hard, but I have seen some students getting into, but thing is that you have to be here. One student, the student was residing in US, and what happened, like one of the existing student who was going through fellowship just decided they don't want to continue, right? So because this student was present there, then and there, right? So the program offered that student that fellowship right away, it was for 2-3 months, but that is really good opportunity to see how the US system works, to put into your CV, your resume, like, hey, you had a fellowship experience from US, but unless you go through USMLE, unless you go through residency, you cannot get licensed. So it's just going to be your experience, but you cannot practice here. You cannot get licensed based on that. But as I said, one fellowship opportunity can land you into contacts, and you may get more experience opportunities, right? Like observership or externship, sub-internship. So whatever opportunity you can get, you just have to grab it, okay? And as I previously mentioned, like research fellowship opportunities you can get, you have to go through their websites. And if you have prior research publications, you can come for postdoc research. So just try looking. We have a very, very big advantage in this era where we have internet, we have a Google power, right? You just have to type in and just create your own, database, create I would say just make a record of 1, 2, 3, 4, like, hey, these are the programs available, there's an opportunity available here, and just start emailing them, just start talking about like, hey, I have experience in prior research and I have done this many publication, I have and I'm very interested in your program. You need just one opportunity, right? You just need one opportunity to come here. And so it doesn't matter if you apply for 100 programs or 200 programs, you just need one, right? So, but you have to do your diligence, right? You have to put that much hard work and time to grab those and search for those particular opportunities. I think I've come to an end of my session. I hope I am in my allocated time. So I'm happy to answer any questions, queries. So yeah, thank you so much.
Rather, we should thank you, Dr. Sheetal, for that excellent elaboration, and it was so detailed that I see comments from our audience, very positive comments, and Krishi Raj, Dr. Krishi Raj says, "You're awesome, ma'am. You're explaining everything very nicely." And Dr. Vishal says, "Dr. Sheetal, thank you for the early morning effort with such intricate details. Appreciate that. Very helpful." He's also asking, what was the PG program that you were enrolled in India?
Yeah, I was doing ophthalmology. I was doing diploma in ophthalmology, and only 6 months were left to complete my my program. But I have to quit that because there was a bond for 15 lakhs and 2 years, right, to serve, which either of two of them I couldn't finish. So I just abandoned.
So I think there is some issue with Dr. Sheetal's net. We would request her to join back again. Meanwhile, if there are any specific queries, you kindly put them in the chat box. Those on the Zoom meeting may unmute and ask their queries. So Dr. Sheetal was trying to tell what was the program she was enrolled in, and probably once she landed up in the US and she did her residency in internal medicine, that program back here in India that she was enrolled in did not matter much in the US setting. So this was a brief overview by Dr. Sheetal regarding what all options are available post MBBS in the United States of America. And I think I personally feel that Dr. Sheetal has done a fairly great job in enlightening all of us about the various
So
options
sorry
which are
about that.
available. No, it's okay, Dr. Sheetal. So we were just discussing that you have elaborated to all of us regarding all the options which might be available. And there is another query. is UWorld only sufficient for step 1 preparation? I think
I
this
wouldn't say
is for
just
you.
yeah,
Yeah.
I wouldn't say just UWorld, but as I said, other materials available as I shared in my slide, right? So UWorld is very good for MCQs, going through MCQs. Back then, when I was preparing, I went through, I mean, UWorld was my main, but I was looking for, I went through Kaplan notes, Kaplan MCQs, but UWorld was my main. But I think nowadays, people are not um, preferring Kaplan. I don't know. Maybe you just have to, see how good they are nowadays. But whatever USMLE videos I went through, I didn't hear about Kaplan. So maybe, but UWorld is main. Other first aid, um, first aid is another, embossed library. I think that's for step 2 CK. But UWorld is going to be your go-to for your all the MCQs for all the steps. It's not just for step 1.
Okay, thank you, Dr. Sheetal, for answering that query. And there is another comment. It says, "Thank you. These sessions are much needed and very enlightening." Oh, thank you for those comments. And our purpose of taking these sessions is that more and more such mentees should get connected and should benefit from these sessions. And we would continue our series of taking these sessions regarding preparations of examinations at undergraduate level, postgraduate level, as well as super specialty levels, not only just in India, but also in countries abroad and other streams, as I discussed about at the beginning of this session. And I think if there are no more queries to Dr. Sheetal, so we would like to express our gratitude to Dr. Sheetal for sparing her valuable time and letting us know about the various options for post graduation which are available in the United States of America, and also for enlightening us that how practically one can go about in availing these options. And of course, like Dr. Sheetal proposed, so anybody who specifically needs counseling regarding this particular aspect, she's available, and you can get connected with us, and we would connect you 101 to Dr. Sheetal, who would feel happy to guide you. And uh,
Yeah, if you make co-host, I can share my contact slide or I can type in whatever
yeah,
you guys.
sure, sure. It would be very nice. Dr. Sheetal, another question has popped up, if you can take up. Uh,
Yeah,
the query says, my question is whether research experience in India any helpful to get a good match for residency program in the US? Dr. Siddhant is asking.
of course. I mean, that's going to be a highlight on your CV, right? Resume, something to talk about. Because as I said, like 2 candidates have exactly everything similar, but one with without any research and one with the research. It all depends like how the program looks into, right? Like whatever clicks to them. But of course, that's a positive experience, right? So, and with that experience, you can always talk about like and highlight. And as I said, you can get into research fellowship here too, based on that experience, and which will of course gonna build you as US experience. So that might help you. And of course, program directors like that you have some research experience or some experience in your home country too.
Okay, thank you, Dr. Sheetal. Another one says that, can you practice in Canada if you have done your MD from USA without having to go through exams in Canada again?
Yes, of course. So, so US degree, what we call is the gold standard, right? So once we have a residency and license from US, practically you can practice anywhere in the world. Okay. So with that certificate, So most of my colleagues, some of my colleagues even practice in UAE for a few years and they come back here. So they're always looked upon. It's the gold standard that you can call. So nobody questions because they know once you have a US degree, it means you have gone through this standard procedure of obtaining your license, and going through all that residency program. So yeah, you can take your license anywhere in the world, in Canada, Europe, and India, anywhere.
Thanks, Dr. Sheetal. Another one says, my college isn't really recognized by ECFMG. And even though some people requested our college to update the information, they don't really care about it. So, can I give USMLE after MD in India?
I'm not very sure, like those who are not accredited colleges, because there's a list of all the accredited colleges, right? And you have to put your college's name and number. They have assigned a number to that. So I don't know how the process works. Maybe you have to see in their website, like what is the some additional paperwork you might have to do. I'm not very sure about that. But of course, you can give USMLE. As I said, you have to consider the time factor too, right? They prefer young graduates. So time is running, time is money, right? So farther away from your medical school, you're gonna lose that. And I want to highlight this point. And I was going through so many USMLE videos, right, just to see if anything changed and what's in the market right now. None of them talk about this point, like, hey, they prefer young graduates. None of them are talking about. This is very important because this program get like hundreds and thousands of applications. So they're not going to screen each and every application, right? So computer does that. So every program is a separate entity here. It's not like, hey, one Nashik University is governing the whole, state or something like that. It's not. Each university is a single entity, right? Each residency program is a single entity. Okay. So the program decides, hey, what the criteria they're going to set up for my residency program. So if they say, I don't care about age since graduation, and some programs are like that. It's not like 100% program, but most programs are like that. Okay. So if they want to set a criteria, I'm going to take the candidates only who has their MBBS within last 5 years. So the computer is just going to eliminate your application. It's not even going to go to human hands, right? So what's the point? You're just making your efforts, your money. It takes, you have to pay fees to apply that program, right? So if computer eliminates your application, it's not even going to your residency program director or whoever is looking at your program. And doesn't matter if you have 100 degrees, if you have top USMLE scores, top US experience, but if they set a criteria and computer eliminates, so this is a very, very, so when you apply, you have to look for that criteria too. Just don't blindly apply. You have to see the criteria. So that's why I'm just highlighting this younger graduates. And that's why I recommend our students to start early. And it's not like, I talked to so many students and they always, I will do post-graduation in India. We do prepare for NEET or whatever entrance exam is, right? And then simultaneously prepare for USMLE. Agar yahan nahi mila, to wahan mil jayega, something like that. That kind of approach. USMLE is not like that exam, right? You have to, one focus, one goal. You have to sit for 14, 16 hours or whatever time you're sitting and just one focus to it. Like, yeah, that's my goal. I'm going to get it, right? तो दो नाव पे सवार होके तो हम कहीं नहीं पहुंचेंगे, ये तो बिल्कुल पक्का है. तो I talk to students, they just don't do it, or they just I will prepare for my entrance in India and then prepare for USMLE. If I don't get here, I'll go there. No, that's not the approach. Okay, so take my word for it. Okay.
Yeah, probably that insecurity factor is there, and especially amongst our students. So there is another query, Dr. Sheetal. Dr. Krishi Raj wants to say that, ma'am, I am an FMG graduate can you share your any social ID so that we can ask you queries? Right now, I am pursuing internship in GMC Nagpur.
Okay, as I said, I can share. Can you make me co-host so I can share my screen?
Yeah, sure. You don't need to. You just start sharing your screen.
No,
You
no,
are in.
it's saying like host disabled, so I cannot.
Okay, okay. So Dheeraj, we request you to help us with this. Dheeraj, are you there?
Or even I can type in chat. I don't know if
Yeah,
on the
maybe.
YouTube. I don't know if they can see it.
No, I will
Um,
post it there. You just type it in the Zoom meeting chat box.
okay.
Or Dheeraj, if you're around and you can enable Dr. Sheetal to share her screen, that would be helpful.
So that's my WhatsApp, right? I urge students to text me on WhatsApp, and then we can talk one-on-one. We can, I can counsel you. I do that all the time. I do that all the time. I take like couple hours talking to each student, explaining each and every details, because as I said, it's not very simple, straightforward process. Like, hey, take this entrance exam and then you will land up into residential here. It's not like that. It's very complicated, very new for us, right? And you can also reach me through my email. So I'm typing my email ID as well. So either way, you can reach out to me. And as I said, just text me on WhatsApp, and then I answer. I may not get time immediately to call you, but we can set up a time to talk, because as I said, it takes like 1 hour, 2 hours to discuss. Okay.
Thank you, Sheetal. Dr. Sheetal, thank you for sharing your WhatsApp number and also your email ID. I have posted the same on the YouTube chat box, and probably those of who want to directly communicate with you, they can do so. But taking care of Dr. Sheetal's time zone as well. So whenever we also communicate with her, we take that kind of precaution that we should not be disturbing her. And because she is in Colorado and the times zone is exactly opposite to our country, and when it is day here, it is night on the other horizon. So that is so nice, Dr. Sheetal, and I can't see more queries here in the chat box. And I think then it's time to uh, say thanks to you once again. And the chat box is filled with messages of gratitude to you, especially for sparing your time and your effort all the way uh, for putting up all these things together regarding guidance about pursuing higher studies in the United States of America. I also extend my gratitude to the other esteemed speaker, Dr. Ateet Fulmali, who uh, who is rather an inspiration for many youngsters who are in the meeting, and they are posting messages here that they feel happy that they can see one of their likes in Dr. Ateet. And I thank you on behalf of everyone, Dr. Ateet, and also for sparing your time out of your busy schedule. And being a resident, he is on call duties, and he has adjusted his duties to suit our timings. Thank you so much, Ateet, for that effort.
Thank you, sir.
And my efforts, my gratitude would not be complete until I thank Anup Kumarji, who is a special person. Those of you who don't know him must know he's a must know person, and all of us have very high regard for him because he is one of the dedicated uh, Ambedkarites who is working on a very large scale, benefiting many of our students, and it's especially visible from the logo of Nalanda Academy, which says democratization of education, and that is what probably Nalanda Academy aspires for, and wins accolades from all over the every corner of the world. I think my efforts would not be complete until I thank the moment, the our movement, because of which we had this concept about getting connected with our brethren, and as talked about in the beginning. So it is we now who are responsible to take this movement ahead, and it is not just a requirement but a responsibility on our behalf, that we get connected with each other and we try to help our youngsters who feel that they don't know a lot of things, but the right effort and the right timing, and the hard work which one puts into will definitely fetch results. And like Baba Sahib always used to say that we have to educate, unite, and agitate. So on this common platform, we are trying to benefit each other. And of course, like I said in the middle of the session, that today you are listening to these talks as mentees, but we expect that very soon, when you would also be on the other side of the table, you should become mentors uh, in whatever capacity you are, and try to benefit our people in whatever best capabilities you can. uh, I would like to thank all the organizations who have been supporting our endeavor, and they have been spreading our message about the sessions for undergraduation, post graduation, and super specialty amongst all groups in the country. A few to name: the International Ambedkarite Doctors Federation, the Dr. Ambedkar Medicos Association, Dr. Babasaheb Ambedkar Medicos Associations, the Jai Bhim Health Endeavor, the residents and the faculty from all the institutes of national importance, for updating you. So, other than the 5 institutes of national importance, the medical institutes, now the new 27 aims have been added to this elite group, and all of our people there have been supporting our endeavor. And of course, our uh, exceptional gratitude to the Nalanda Academy, who has provided this unique platform to us to get in touch with each other. And with this, we would like to conclude the second session that we have taken up in this recent time. And after expressing my thanks to both the speakers, I would like to close here and look forward to again conducting and organizing another session which would be beneficial to our fraternity. And we would be planning this very soon, and you would get the information on the various platforms that we get communicated through. With this, I thank everyone. Thank you so much. And Jai Bhim for now. Bye, everyone. Thank you so much.
Jai Bhim. Thank you so much.
Thank you, sir.
Yeah. Thank you, Dheeraj, for all the support that you have given us for this meeting. And may I request you to conclude and end this session for
Yeah.
all of us. Thank you,
Yes, sir.
Dheeraj.
Yes. Yes. Welcome.